Hello from HIMSS 2019. I am so pleased to be joined by Deepak Chaudhry today. Deepak is leading our HITRUST audit as part of BDO. Our company is now about 3.5 years in, 2 years selling into the market, and about a year ago, I got a knock on my office from our compliance officer, and he said, Guillaume, we need to do HITRUST. Our customers are asking for it. Should we do HITRUST SOC 2? And he presented this plan from BDO, so it's been a pleasure to go through this process with you. I think we're across our fingers, we'll be done and certified come April, but please just tell me more about yourself, your firm, what you do.
Yeah, well, thank you for the opportunity to speak to you today. BDO is the 5th largest public tax accounting firm internationally. We sit right underneath the Big Four, and we are now transforming our business to really focus on advisory services, so advisory and assurance services. So I lead our national healthcare technology and HITRUST practice for BDO.
Yeah.
Been there for roughly about 2 years or so. Prior to joining BDO, I was the CIO for the Public Health Information Exchange in Houston. So all of the Texas Medical Center participants were my clients, and being able to do interoperable exchange between disparate EHR systems. And during that time when I was there, we got a knock on the door from one of our participants that we work with, saying that we need to become HITRUST certified. And so I went through that journey.
Was this a health system?
Yeah.
That was, oh, okay.
So
yeah.
it was actually a very large commercial payer
okay.
that was requesting the certification. And so fast forward, joining BDO, and now I lead their national practice for HITRUST.
How did you pick at the time between HITRUST and SOC 2? Because I know this is something that came up when we were evaluating.
So it really depends on your environment. Now, the choice for us was already made because we had business partners that were mandating the framework for HITRUST.
Okay.
So we really didn't have an option to look at SOC 2.
Yeah.
However, I think there's an advantage to each one of them. It really depends on how you're positioning your environment. And HITRUST is definitely a lot more complex and challenging in nature.
Yeah. Why should, so interestingly, our health systems haven't universally demanded HITRUST or SOC 2 certification. It significantly, I think, helps in the sales process. But what are the leading reasons you think a vendor like ourselves or a health system should demand that level of certification? What does it mean to choose a HITRUST certified vendor versus someone who maybe hasn't gone through that process?
That's a great question, and I go through that all the time. So as you may be aware, I work with startups in the Texas Medical Center cohort, incubator center, and so I'm speaking to them all the time. I think you guys were participants at one point.
A few years ago, yeah.
Of that program, and it's a challenge, right? Because they want to adopt a security framework to be able to show maturity in that discipline, but it's difficult and challenging because they may not have the resources available to do so, right? And so you have to evaluate the pros and cons, and the biggest pro that you have as an organization is that you're providing your business partners a level of comfort that their PHI, their data in transit or at rest, is secure, right? I mean, one incident, one breach, you're going to be in a lot of trouble, right? And so are they. So in order to protect yourself from a risk mitigation perspective, adopting a framework like HITRUST improves your security posture as a whole, but also gives you a competitive edge. That's pretty loud.
The competitive edge.
It gives you a competitive edge, right? So to be able to go to the marketplace saying, hey, you work with us, we're going to give you a level of comfort that your data is going to be secure.
Yeah, and that's an interesting. That's an interesting point, because a lot of these contracts too, indemnity is capped to a certain amount. So you do business with a startup, if something goes wrong, at $3 million, $5 million, if you've got a startup that spent a good amount of money on their insurance, after that you're on the hook as a health system, right?
Correct.
So as a large multi-billion-dollar health system, how would you weigh the pros and cons? If you had two vendors in front of you, technology is relatively even, where does HITRUST come in that decision-making framework?
It makes a huge factor because, if I'm the decision maker and I'm evaluating vendors, there's a security questionnaire I'm going to send over to all my vendors to make sure that they've got the appropriate tools in place. And if you check off the box saying you're HITRUST certified, you've already made my decision.
Yeah. Well, let's talk about those security questionnaires. We've seen a lot of them, and we filled out a lot of them prior to even engaging in this process with you, and hopefully they'll be a lot easier moving forward. How much sanctity should a health system place on the responses they get on that vendor? If I'm you're working with us right now and you work with other companies, and we've actually built out a lot of infrastructure to support HITRUST. We have dedicated DevOps, we have a number of, it's expensive, but it's worthwhile. We're doing it because it's the right thing to do. But how much credence should a health system put on that security audit, especially if the vendor that's filling it out is not HITRUST or SOC 2 yet?
And so that's a great question, because when I was at the HIE, all of my participants were sending me those same questionnaires, right? They're going to say, hey, if you're going to host our data and you're going to be able to do data and transit and exchange data with other members of the HIE, then we want to make sure that your environment's secure, okay? Mm-hmm. And so there's actually, between security and compliance, a lot of weight is put on those questionnaires, because that's your only response to the CISOs and the chief compliance officers that you may not have a relationship with. Mm-hmm. So they're evaluating your security posture and maturity based on that questionnaire and that questionnaire alone.
Mm-hmm. Yeah. So talk to me about Well. We've been working together for how long now?
It's been roughly about almost a year.
Okay. Yeah. How long? When did we kick off the actual audit process?
I think it was probably in the summer.
Summer of last year.
Summer of last year.
How long does a HITRUST process take?
Well, you guys.
Typically
it takes about a year or so.
Okay.
But obviously, with the priorities that are put in place, you guys have really dedicated quite a bit of resources and energy around it. Mm-hmm. So, you guys might be in that 6 to 8 month time slot, which is actually very impressive.
Yeah. What's the number one thing you'd tell a vendor who's not HITRUST certified yet that you would give them as advice? At what stage? Because we were small for quite a while, and I think we finally reached the maturity, and we invested in this. I think maybe before a lot of companies invest in this. What's the right time? What would you tell those vendors thinking about security, who care about security, want to do business with a large health system? What is the one piece of advice you give them?
So, the HITRUST framework is a mature framework. It encompasses NIST standards, NIST 853, mm-hmm. ISO 27001, along with HIPAA as well, okay? So what I tell everyone actually is, at minimum, perform a facilitated self-assessment to understand where you are in terms of maturity against that framework. This way you'll have an understanding of where your gaps are. Whether you become HITRUST certified or not, at least it'll expose you to your gaps, where your areas of weaknesses are, and you can come up with a remediation plan over time to fulfill those gaps.
Yeah. And then in terms of staffing a team to meet the security requirements of large health systems, how do you typically see that? Is there a compliance officer? Is that handled by the CTO? What's the staffing that's typically required? So
if a vendor like yourself is getting involved with a large provider, you would have a CIO, the CISO. The CISO is independent of the CIO. So the CISO reporting is actually directly, in most cases, to the CEO of the organization, to maintain independence. You have chief compliance, and you also have chief quality as well.
Yeah.
Okay. And at that point, you have different layers of leadership underneath them.
Yeah. And that'll be on the health system side or the vendor side?
Health system side.
What about on the vendor side?
The vendor side, there's multiple hats, right? It really depends on the size of the vendor. So typically, the clients that we deal with, there's a dedicated CISO. In some cases, there's a CTO who wears a CISO role hat as well. So it really depends on the size of the organization.
Yeah. Wonderful. Well, thank you very much. You've been a great partner. I know our compliance officer has really enjoyed working with you. We're looking forward to finishing the final components of this, making a record in terms of time to being HITRUST certified.
Absolutely.
I expect the trophy once we get that done. Thank you very much.
Thank
really
you.
appreciate your time.
Take care.
Thanks.